Millions of people suffer from headaches and from migraines, but you don't have to sit in a dark room and just hope it goes away. Dr. Robin Ockey from Utah Valley Pain Management has identified several treatment options. Thank you for being here. For those who suffer from migraines or regular headaches, the pain is really debilitating.
Yeah, it sure is, and it's kind of sad because it's such an under-recognized and under-treated condition, not just migraine headaches, but headaches in general. And you know, people would understand if I said that 50% of adult people in the United States will suffer a headache this year. But what they're not as aware of is that about 4 to 5% of people have headaches that are more than 15 times per month. And it's just completely debilitating and destroying lives.
Well, I know you fit different headaches into different categories. So how many different headaches are there? Oh,
there are so many different types, and we really wouldn't have the time to go through all of them. But you know, if you look at headache, migraine, for example, is so common. 10 to 12% of adults in the United States have migraine, and it's much more common in women, 2 to 3 times more common in women.
Really?
1 out of 6 women have migraine headaches.
Would you define that as one of the most common types of headaches, or what is the most common?
Probably tension type headache, chronic tension type headache, but migraine headache is so debilitating and such an issue that it deserves specific discussion.
Well, a lot of people will pop an Excedrin and over-the-counter medication and hope it goes away, but you say actually getting to the root of what is causing these headaches will actually provide more lasting relief.
Well, I think that's exactly right. I think that they're, like I said earlier, misdiagnosed frequently.
Yeah.
And I think understanding what is a migraine headache and is this truly a migraine headache? Because it is often misdiagnosed, and people frequently don't go to a physician to really get the right diagnosis.
So what is that line? How do you determine if it really is a migraine?
Well, it's really a clinical diagnosis. I mean, migraine headaches are typically pulsating and throbbing. They are commonly associated with nausea and vomiting. Frequently you're bothered by bright lights or loud sounds, and they disable you. Even just your everyday exercise or everyday activities like walking or climbing upstairs can be debilitating. A migraine sufferer often will just want to go into a dark, quiet room and lay there.
Well, I'm assuming this isn't just a Halloween prop that you brought for us today. How does the spine, how does the actual structure of the spine affect those headaches or cause those headaches even?
Well, the reason I brought this is because another type of headache, cervicogenic headache, is so underdiagnosed as well. Cervicogenic headache is pain where the headache is coming from structures in the neck but felt in the head. It can occur because of the natural degenerative process that occurs in our lives, but it can also occur from a trauma, like a whiplash injury.
So how do you treat that?
Well, it depends on what the cause is. The primary causes of cervicogenic headache are these structures in the upper cervical region. The most common cause is this C2-3 facet joint, this joint right here. And we know precisely what the nerve supply is to that joint. So if people don't respond to conservative care like physical therapy or anti-inflammatory medication, and pain persists at least 3 months, then we can actually prove that that's the cause of the pain by doing a little diagnostic block where we numb up the nerve supply. And if that takes away the headache, if it aborts the headache, then what we can do is destroy that nerve branch by burning that nerve through a process called radiofrequency lesioning.
It's good for people, I think, to just know there are medical options that can abort the headache, as you say, or take the pain away. Where can people go to set up an appointment and get that clinical diagnosis you talked about?
Well, our website is utahvalleypain.com. We're Utah Valley Pain Management. We'd love to try to help.
Great. Dr. Ockey, thank you so much.
You bet.